Once again, the TIC Salut Social Foundation presents the annual results on Map of Trends, an annual report on the level of ITC's strengthening in the Catalan public healthcare system. The 2018 report has been based on three main pillars. Information systems, with 90% of total participation out of all suppliers. Citizens' attention, with 61% participation over the total, and, as a novelty, innovation, which has entered 50% of the participation of the SysCat's total suppliers. Next, we present the different topics, comprising these main ideas. For information systems, interoperability, data electronic exchange, Catalan Healthcare electronic record, IS3, ECAP, digital medical imaging and cybersecurity. For citizens' attention, La Meva Salut, digital procedures and ITC information for citizens. And innovation, virtual reality, robotics and artificial intelligence. The International Standards Procedure is a well-established reality in the system. HL7 and SNOMED CT are still being the most frequently used for pathological anatomy, immunizations and allergies. Also for frequent asked questions and social care problem solving. And LOINC for medical laboratory observations. In this context, the electronic data interchange between healthcare centres is still a slightly rising trend regarding what the report is showing in these last 3 years. The most frequently interchanged information is the one referred to administrative data, reports, laboratory results and radiology. During this last year, HC3 publications keep sustainable growth increasing by 13.3% from 2017. These are some of the updating actions performed. Quality plan implementation of messaging and published data. New brochure of assembled files types using SNOMED CT for medical reports and bureaus complementary tests. SERAM for imaging tests and SEMNIM for nuclear medicine tests. Permission of allergy publications and functional evaluation ranges. Professionals alert enabling on incidents detected in current publications. Brochure increase of published clinical variables. New web service on organised laboratory data with LOINC codification. According to these surveys, 60% of suppliers assume they have access to the HC3 information through the professional viewer. Moreover, they add data to their clinical workstations via web service. The remaining 40% track data through the HC3 professional viewer. All this represents that 78% of entities believe that the quality plan implementation in brochures, homogenization and HC3 validation has improved the data quality of publication in their entity's platform. The display on complex chronic patient and advanced chronic disease notification has been an improvement in the instrument's quality of healthcare professionals because it redirects to the PIC contents in order to offer customised and shared care with other healthcare stages. 79% of the entities favourably evaluate this feature. Furthermore, this last year, the HC3 has been connected to all the social services basic areas of Barcelona's City Council. The next step is the progressive intercommunication of the whole territory. One of the workstations more used by healthcare professionals is the ECAP. 25 primary healthcare entities are using this tool. Currently, the ECAP is integrating the HC3 with the viewer, for example the shared clinical track and HC3 files, to ease the information search for healthcare professionals. In the IS3 area, and concerning the number of activities filed, 14,000 new daily referrals have been spotted in production to the platform, as well as more than 7 million derivations made by IS3 platform. It is significant that more than 25 integration projects among SysCat suppliers are currently being carried out. The cloud management models are increasing their deploy. An excellent example of this reality is the digital medical imaging. The SysCat is presented as the pioneering in this technology implementation. At the moment, the 82% can visualize PACS images from external sites. The vast majority of entities can access the digital medical imaging which is produced by themselves from external sites. 28% of the entities have declared that in their institution's PACS, information from other entities is gathered. Catalonia is the pioneer and the reference at European level in the digital medical imaging cloud implementation. This solution is applied in the project context driven by the TIC Salut SIMDCAT, or Catalonia's digital medical imaging system. This is another sample of imaging diagnosis services, which are bringing together new market technology solutions with digital transformation processes. But how can suppliers guarantee the security of these data? In light of the growing cyber attacks, vulnerability due to the digital presence and the emergence of technologies like the Internet of Things, 86% of healthcare suppliers confirm that they are protected against possible cyber attacks. All entities are working in the cybersecurity area as a priority way in the healthcare centre's digital transformation domain. 95% of the entities have mentioned that they save backup copies outside their data process centres every 6 months. 79% performs recovery tests from the backup copy storage mediums, ensuring the data integrity. 18% declares to have specific insurances against ransomware attacks and the impacts that it could cause. The information systems managers are the professionals responsible for this area of work. They have a quite significant role in the implementation of the digital transformation requirements ordered by TIC Salut. As to eConsulta, 75% of primary healthcare suppliers survey respondent has revealed that they have this service integrated into the HIS. There are more than 60,000 people who are using it as a communication tool with their family doctor. Lameva Salut users amount is increasing, with 37.82% from 2017, overcoming by now the 450,000 users. 100% of survey respondents say that the Lameva Salut services are a handy tool, and the 26% of entities assert that they have carried out informative sessions with citizens for encouraging the use of this tool, since the professionals' training in centres is 50%. 80% of entities remark that they have reduced the use of paper in their entity regarding the increasing use of internet services or arrangements. From this total, among 50 and 70% say that it is administrative processes as medical consultations or appointment reminders by instant messaging. The 78% of entities have revealed their need informing areas to the citizen on healthcare systems ITC services. Hence, 21% of the bodies have stated that they are developing technologic tools incentive programs, both for professionals of the centre as for citizens. Reactive tool supremacy rather than proactive are registered to evaluate the citizen's experience in the centres. Suggestion documents and complaints or satisfaction surveys are prevailing. While through ICT, this procedure could be speeded up by virtual community development. We have detected the interest in this service, but only 10% of respondents assert they have it. One of this year's study novelties is the Innovation Survey. Among all variables, we outlined the virtual reality results, artificial intelligence and robotics. The 27% of surveyed entities state that they use virtual reality tools. The most significant uses are teaching, pain control, surgical procedures, or phobias control. In teaching, the immersive environment recreation based on real use cases is quite useful for the students because it allows them to experience a first approach use cases, particular protocols and procedures in a pretend environment before being used in real cases. Everything is suggesting that the use of this technology will keep increasing and gaining scope as a standard working tool for professionals and patients. Artificial intelligence separately presents a less full integration in the healthcare process than virtual reality. 21% of the total surveyed suppliers are implementing this technology. The increased estimation during this year is 9%. Artificial intelligence is mostly used in these specialities: decision-making support, data management, treatment recommendations, and diagnosis support. In order to get deeper in the solution, reinforcement and supporting the healthcare service, the prospective working areas are processing data algorithms, data encrypting, security and confidentiality, training for professionals. SIMTCAT project, for example, has more than 2,000 information terabytes in medical image. This will let to SISCAT the development of new innovative projects from the bulk data management with artificial intelligence. Finally, robotics is showing a significant capacity that allows improving the efficiency and effectiveness of interventions and treatments. 20% of surveyed centres remarked they had used it. The area where it is widely used is surgery. 15% say that they have planned to enforce some robotic projects in the following areas: aging care, information and reception, and neurological rehabilitation. The innovation applied to technology is looking to release professionals from tasks that are slowing down the management process, reducing the diagnosis and surgical times. They allow to adapt healthcare to the social needs, where the most significant is to focus on a people-centred care model. The TIC Salut Social Foundation will continue providing this process, helping the system for digital transformation and working to promote Catalonia as an international reference.